Kenyan government and counties are now facing a great challenge of this particular menace, this particular monster called cholera, because it has claimed lives. Now, we need to know why cholera. Why is it normally disturbing Kenyans? Why is it giving us sleepless night? Why is it killing our own people? The Kenyan government is doing very wonderful job, and we thank one of the organization that is called ICG, International Coordinating Group, which has provided Ministry of Health. As we speak, they have provided 1,533,199 oral cholera vaccines, which is now being given to over 1 year old and above. And the operation has initiated just right now in 8 counties that we are going to talk about. Now, this cholera has been giving not only Kenya but also globally, because I have with me the global data that we should be able to know that around 1.3 million to 4 million people are being affected by cholera globally. And among these millions of people, 210,000 to 143,000 people have died because of this particular disease. And if we narrow this down to our country, Kenya, we find that as per 18th July data, around 11,181 cholera cases, those are confirmed positive cases, have been reported to us under surveillance and public health, to Ministry of Health. And this, we have lost souls. We have lost 196 people, meaning 196 people have died in around 26 counties where there is hotspots. And this calls for Kenyans to, with the Ministry of Health and counties, to uplift their ways of preventing this particular disease. And Kenyans have done a very wonderful job, because as for first round of vaccination, which occurred in February 2023, 2.2 million people were vaccinated, that is age above 1 year. They received oral cholera vaccine, and this was in counties like Garissa, in Tana River, Wajir. And we also thank the international group for providing that 1,533,199 oral cholera vaccines, which they have initiated in 8 counties that are being mentioned here.
In this campaign
of oral
especially
cholera
in Suba South,
have been initiated.
in Kajiado, we are looking at Kajiado East.
Today, that is 3rd
in
August 2023.
We are looking at Moyale,
These particular counties
Kamkunji and Embakasi Central in Nairobi County,
as per the Ministry
Wajir North
of Health.
in Wajir,
And this call
Mandera East
for
in Mandera
us
County,
now to ask a question about this particular cholera. What is it? How can we transmit it? What causes cholera? What are the signs and symptoms of cholera? That is clinical presentation, how the patient can present with it. How can you know yourself that you've contracted cholera? How can we diagnose it? How can we manage it? What drugs do we use in managing cholera? And what are the modalities of prevention that we put in place so that we can avoid these particular deaths that are killing our people? If you love this channel, kindly click the notification bell, written subscribe, turn it on for more videos that we will post. And for my returning subscribers, thank you so much for clicking again this video and staying with me. Kindly put some comment in this particular video. Now, let's jump into the video and let's know more about cholera. Cholera basically is a gram-negative facultative anaerobes, and it's an infection of small intestines caused by an organism called Vibrio cholerae. And this particular organism has an incubation period starting from hours, that is from 5 hours to 2 to 3 days, for the symptoms to exhibit in a human being after ingestion of this particular bacteria. And majorly transmission is due from fecal oral route, what we normally eat from our hand to our mouth through feces. Contamination of feces through water or through food, through fruits, through grains, what we eat normally affect us, and if we ingest this, we ingest Vibrio cholerae, and it causes the infection. And through direct contact is not so much feasible to bring this particular infection. And clinically, a patient will present with following signs and symptoms. Now, there is what we call acute onset of diarrhea and vomiting. This is normally presenting in each other diseases, but in cholera, the diarrhea is called rice water diarrhea. If you look at your rice after washing your rice when you want to cook it, that particular nature and the look, or you see photographically through your eye and your mind, what you see, that rice water is now pathognomic and diagnostic of diarrhea in cholera. It is not bloody, but it's rice water diarrhea. And vomiting is always clear. Vomiting is always clear. It can start with nausea and vomiting. And when a single person can diarrhea millions of Vibrio cholerae in a single drop of the stool. And when this infection occurs to you, you will diarrhea and vomit until now you become dehydrated. When this is not, when there is no intervention, you can even die all of a sudden. Now, when you have dehydration, you will have your body will start to be weak, that you will have to be lethargic, you will have body cramps, you will have general body tiredness, your skin will be clumsy, cold, you will be sweating, you will be very, very thirsty, you will be anxious to drink, but that urge of drinking will be suppressed because you are very, very weak to do to. You will not be able to walk. Even your skin will start wrinkling, and you will be looking like an old man and somebody who is thin. If you are a child, they will have the frontanelles here will be very, very sunken. The eyeballs will be very, very sunken. Their skin pinch will be returning slowly more than 3 seconds, particularly when you touch the skin pinch. Even both adults and children, the skin pinch will be returning very, very slowly. And if you look at their lips, there is very, very dry. Even the zygomatic bones, these bones here, they will be very, very prominent, and you may think this person has been sick for a long time, but no, this is something which is acute, happening in hours. You diarrhea almost 10 to 20 liters of diarrhea in a single day. This can cause an imminent or acute kidney failure, and this one may bring your death to your door. And even electrolytes imbalance, you will even start having Kushmal breathing, you will have difficulty in breathing, you will have even seizures, that is conversions due to electrolytes imbalance, and even acidotic breathing due to electrolytes imbalance. So all those patients will be preventing like that. Fever is very rare. Only when there is secondary infection, then a patient may present with fever. The strains causing these particular symptoms are Vibrio cholerae V01 and Vibrio cholerae V0139. They are toxic and they are virulent, and their presentation is the same. Now, we can diagnose this through laboratory investigation, and it is very, very important when somebody is passing that stool, that rice water stool, that rice water colored stool, we take that particular sample through anal swab, and we take to the lab for laboratory investigation. And in fact, in the lab, there are some important information that I should be able to share with you, because we normally look at the morphology of this Vibrio cholerae, and we report. We do culture, characteristic, biochemical reaction, and then even serological identification. Now, through the microscope, we look at when we see the single polar flagellum is pathognomic of Vibrio cholerae, and gram stain. I started by saying it's a gram negative. Also, if we do gram staining, it will be a gram negative bacteria which has curved rod and is motile. That is motile. In a tembea, it's walking, in quotes. It's moving up and down. In management of cholera, this one will be managing case by case, but the hallmark of it is to replenish and to build up the electrolytes that you lost through vomiting and diarrhea. And if it is mild, we'll give you oral rehydration salt, that is ORS, just to drink like this until we'll see the signs and symptoms of diarrhea subsiding, signs and symptoms of dehydration subsiding. But when it is very, very severe, that now you are going into shock, you cannot walk, you have those muscles cramps, you are developing kidney failure, acute dehydration, then we have to admit you into the hospital. Of course, we do laboratory investigation pending. The laboratory investigation will start you on fluids, IV fluid, intravenous fluids. We may start with Ringer's lactate is the preferred one, and according to your body weight, we'll give you maybe up to 6 liters of that fluids in a day, depending on how you were dehydrated. Of course, we will also introduce antibiotics like doxycycline. We may introduce like azithromycin, ciprofloxacin, depending on whether you are pregnant or not pregnant, or even sensitivity or even side effects of those particular drugs. If you are a child, we may introduce zinc sulfate, because zinc sulfate will replenish the electrolytes that are lost and even reduce the effect of prolonged diarrhea. We may also encourage you to take a lot of bananas and even coconut water, because we want to target the potassium which were lost during diarrhea and even slightly during vomiting. So this is very, very important to rectify the electrolyte called potassium when you are passing that loose stool during diarrhea. We may also encourage mothers to continue breastfeeding their children if at all they are breastfeeding, and even adults, we encourage, if they are able to eat anything that can build their body, any balanced diet, anything that can, so long as they are not vomiting, we can also encourage that. Of course, we can also do preventive management to give you drugs that will control vomiting and even drugs that will control that diarrhea. Now, in prevention of cholera, this is now based on me and you watching this video, because we want you to treat your water. Make sure that any water you take, you boil it, you treat it. You can treat it with chlorine. Hand washing is very, very important, because it will prevent you from contracting this particular disease, because you had earlier on I said that transmission is via fecal oral route, via feces, through what you hold in your hand and put in your mouth. That is what you eat. So hand washing is very, very important in this particular scenario. Even government as a whole, treatment of sewages and waste disposal is very, very important. We normally try to encourage us to avoid the cut methods or even defecating, open defecation, because when it rains, all this will be washed down to the river where you normally take your water, and some people normally just drink water without treatment, and they don't even boil it very well, so they may contract cholera due to that open defecation. Only a single poop contains millions of these Vibrio cholerae, so we encourage that you avoid open defecation. And Ministry of Health plus Public Health normally encourage each and every home to have a pit latrine if you can't afford a toilet. So it is very, very important to do that. For those who have been diagnosed with cholera and they have been taken to the ward. Those things that they used at home, what they handled, the clothes, the beddings, all those materials should be sterilized with dick and washed thoroughly. And you may even buy gloves from the local shop so that you don't contract this particular disease when you are handling this patient who is having cholera. The government is also doing a very, very important work through the surveillance team and also through the community. You report any case that you suspect that might be having cholera early enough so that we can put restrictions in hotels, in eateries, in places where people sell things that people can eat and contract this particular disease. So surveillance and public health play a very important role together with you in the community in reporting this particular cases. Vaccination is very, very important in prevention of cholera, and I have with me a literature that will help us to know what is taking place today in Kenya on those 6 counties that are getting the vaccines. Now, WHO has approved 3 main vaccines, that is Ducarol, Sanchol, and Uvicol. Ducarol is given orally. It's over 2 years, and should be able to delay this 7 to 6 weeks apart after giving the first dose. So there are 2 doses that are given, and this is mainly for travelers, and it's given for 2 to 5 years also, and 2 to 5 years of age can get up to 3 doses, and 2 doses normally provide protection for 2 years against Vibrio cholerae. Both Sancol and Uvicol Plus is what is now being rolled and what is now being given now, because given over the age of 1 year, and minimum delay after giving the first dose is normally 2 weeks, and this will give us a protection of 3 years. Because of the nature and what's happening now in Kenya, sometimes they might give 1 dose, but 1 dose normally give a short-term protection. But prevention is better than cure. Better you get that 1 dose than not getting at all. So if you feel that somebody has contracted cholera, if you see those signs and symptoms, kindly report. And if you are at home, kindly drink water. And if you feel that drinking water is particularly very, very important to replenish your body, to make your metabolic rate high, make your kidneys function well, make your heart function well, watch the video. I don't know whether it is appearing here or here. Watch that video on benefit of drinking warm water. You will really love it. See you in the next video.